ESR. What is ESR and how is it measured? The Westergren ESR is the gold standard and is a measurement of the distance in millimeters that red blood cells RBCs fall within a specified tube over 1 hour. ESR is an indirect measurement of inflammation based upon alterations in acute phase reactants and quantitative immunoglobulins. What are acute phase reactants? Acute phase reactants are a heterogeneous group of proteins, fibrinogen, haptoglobin, CRP, serum amyloid A, ferritin, alpha-1 antitrypsin, and others, synthesized in the liver as part of the acute inflammatory response. Common inciting events include infection, malignancy, trauma, tissue injury, or rheumatic disease. Interleukin-6. IL-6, an inflammatory cytokine, is an important mediator that stimulates the production of acute phase reactants. What factors influence the ESR? Any condition that causes either a rise in the concentration of acute phase reactants or hypergammaglobulinemia, polyclonal or monoclonal, will cause an elevation of the ESR. The increased concentration of these proteins decreases the negative charge of RBCs, dissipating into RBC repulsive forces and leading to closer aggregation. Rouleau formation. This causes the RBCs to fall faster, resulting in an elevation of the ESR. Non-inflammatory conditions that can elevate the ESR typically through an increase in plasma fibrinogen include pregnancy, diabetes, end-stage renal disease, and heart disease. In addition, aging, anemia, female sex, and obesity can be associated with an elevated ESR. Alterations in number, polycythemia, size, microcytosis, or shape, spherocytosis, sickle cell of erythrocytes may physically interfere with rouleau formation and thus lower the ESR. Pearl, a rough rule of thumb for the age-adjusted upper limit of normal for ESR millimeter per hour, is male equals age 2. Female equals age plus 10 2. What causes an extremely high or extremely low ESR? Markedly elevated ESR greater than 100 mm per hour. Infection, bacterial 35%. Connective tissue disease, giant cell arteritis, polymyalgia rheumatica, SLE, other vasculitides 25%. Malignancy, lymphomas, myeloma, others 15%. Other causes 25%. Causes of markedly low ESR. Markedly low ESR, 0 mm per hour. A fibrinogenemia, dysfibrinogenemia, gammaglobulinemia, extreme polycythemia, hematocrit greater than 65%. Increased plasma viscosity. Is the non-automated, 60-minute Westergren method the most commonly used technique to measure the ESR? No. Surveys reveal that roughly two-thirds of laboratories across the globe use either modified automated measurements based on the Westergren method or alternative novel methods. Techniques based on the Westergren method utilize specialized vacuum tubes that can be filled without the need for transfer by a technician. Many of these instruments use infrared light to measure the final length of sedimentation, with results measured at 15 to 30 minutes. Depending on the instrument and then extrapolated to Westergren 60-minute values. Alternative novel methods of ESR measurement may use centrifugation or rapid acceleration of the blood sample followed by photometric rheology to measure rouleau formation. This latter technique uses an infrared laser to track the RBC plasma interface at several points during sedimentation and then transforms the data on established sedimentation curves from the Westergren method. Results can be available in as little as 20 seconds to 5 minutes with some instruments. Several studies have shown that results may differ between automated ESR measurements and the traditional Westergren test, especially at higher ESR values where automated values are often falsely lower. Describe an approach to the evaluation of an elevated ESR. A. Complete history and physical examination and routine screening laboratories, complete blood count, chemist tries, liver enzymes, urinalysis. Make sure that routine health care maintenance is up to date. Repeat ESR to ensure it is still elevated and there was no laboratory error. B. If there is no clear association after step A, consider the following. Review medical record to compare with any previously obtained ESR data to determine how long the ESR may have been elevated. Check SPEP, fibrinogen, and CRP for evidence of acute phase response as well as to rule out myeloma or polyclonal gammopathy. C. If still no obvious explanation, recheck the ESR in 1 to 3 months. Up to 80% of patients will normalize. Follow patient for development of other symptoms or signs of disease if ESR remains elevated. Thank you.